Every year I'm in practice, I become a bigger advocate of motion preservation surgery. Every year I move closer toward my own back surgery, I become a bigger advocate in motion preserving surgery, right? And I look at that, I'm like, okay, what would I want if I were you?
Hello and welcome back to the Spine Pod. B, this was such a fun one.
If all practices operated like this, spine care would be so much easier.
Oh my gosh. So tell everybody where we are.
We are out here in Reston, Virginia at VSI with Dr. Christopher Good, and he has built such an incredible practice out here.
I don't want to leave. I'm
It's amazing.
Bury me here. This is how things should be. Like, such an incredible practice, such an incredible surgeon. And just, I mean, everyone we've met here has just been phenomenal.
It's amazing how their practice has also adopted and evolved over time due to the changing patient demands that they've seen. And you can really see it throughout the whole practice. So they've got this building that you can see from everywhere, and they've really got all the components of care that you would need if you're going to get spine care. And it's really impressive what they were able to build. He's the president and CEO here, and just a grounded individual who puts patients first. And you can see it throughout the whole practice.
Absolutely. They just did a rebrand to VSI, and he, in his personal life, in his professional life, he walks the walk. He doesn't just talk the talk. And everything is around putting the patient first. So we had really great conversations with him about that. We got to go and do a tour of his practice, which is really unique. I think as a patient, it's so cool to see it's all under one roof, which is what you dream about, you know? So I'm excited to share this one.
Yeah, he's a husband, and he's got, 3 kids and a movie star dog named Griswold that's been all over the news. But all the different components, he's really a surgeon that does it all. He is a huge proponent for motion preservation and looking at robotics and AR, VR, and he's really taking all these different components that helps drive care forward and bringing them together. And I think it's incredible that the practice he's made and bring all the things under one roof to help push patient care forward.
Absolutely. So this is an exciting one to watch. Let's let him get into it. Enjoy this one with Dr. Good.
Dr. Good, thanks so much for taking the time with us today.
Thank you so much for coming out. I really appreciate the invite.
Absolutely, absolutely. I mean, what a gorgeous, we couldn't have picked a better day to come out here.
I was about to say, coming from Austin, I can't stop talking about the sunny 75 degrees. I left the 100 degrees in humidity. So I was so glad when you're like, come on down, let's do this.
We planned it. It's graduation weekend around here, so we took a vote.
And this is for the good weather.
Really appreciate it.
That's fantastic. Well, we're here sitting down with the president and CEO of VSI, and what a phenomenal practice you guys have created out here. I want to give out a shout out to your marketing folks as well, because you can see this building from miles away. But it is absolutely stunning what you guys have created here. And we're fortunate to be able to sit down with you and just your background, your accolades, the things that you've done. This is not the first time you've been behind a camera. So I've seen you, I think, on Fox, on ABC, NBC. I've heard you on podcasts. You've been named top doctor by numerous organizations. And so we're very fortunate to sit down with you. I feel like we're missing a component. I'm looking around, I'm wondering where Griswold is today. Because he's the real, I've seen your dog on TV now more times than I've been on TV. So
I just had a patient come to me, and he's watched everything that's out there, and he literally chose me because you got to have a dog person. I swear to God.
That's what it takes sometimes, you know?
So funny.
That's the differentiator for you.
It's so fantastic. But I've seen a lot of that. But truthfully, before we start into a lot of the topics that I want to talk about today, I want to jump in, hear a little bit more about your backstory, right? You know, your personal story and really what started you and got you into medicine, because, you know, you've been here about 16 years now and now you're kind of leading the charge. But what got you to this point? You know, what made you want to do medicine? I know you have, you know, personal situation that really brought you to this. And I think, you know, more than anything, a calling, and things happen for a reason, right? And I don't think everybody has a story like you have. And I'd love to hear it if you tell a little bit about your, you know, personal journey to medicine.
Sure. So, you know, I often tell people like the field of spine surgery chose me rather than the other way around. And the other thing I'll say that really catches people is I've known I was going to be a spine surgeon since I was 10 days old. And they're like, but so I grew up in Colorado. My dad was ultimate outdoorsman, Rocky Mountain National Park. You know, my family built a lot of Estes Park. And so my dad was a manager of ski area and actually had an injury where he fell out of a chairlift when I was 10 days old. And so literally my mom like throws me at grandpa and like, off she goes, right? And this is the mid 70s. And so he crushes a bunch of levels in his back when he lands on his feet. It's a very common kind of fracture. And, you know, this is the 70s, right? Like we did not have modern spinal implants or really good surgery. And so a neurosurgeon in Colorado did a surgery where they opened up his back where it was all broken and they just took bone graft and like squished it on the spine. And then they put him in a body cast, hoping those bones would weld together to fix the fractures. And so I have pictures of me as a little baby, like sitting on dad's body cast, or they've got my little footprints, like, you know, in ink, like on the body cast. And so, you know, he had, you know, a very severe injury. And so I grew up just dealing with everything that went along with really, you know, failed back surgery, especially 1970s, you know, failed back surgery. And so, you know, I remember like, growing up, I was always like, I'm going to be a doctor, you know, I'm going to help people like my dad, and had no idea what that means because we had nobody medical in my family, right? My family are like outdoors people and teachers, right? But I grew up always thinking that was kind of my calling and what I wanted to do. And I think it was really meant to be because just literally every step along the way, the decisions I made and the things that happened to me or I made happen just really, it just, you know, skyrocketed in that direction. And so I was like, I'm going to be a spine surgeon, you know, as a little kid. And here I am.
You did it. That's amazing. I mean, there's no better purpose in life, right? Than like you have an experience as a child that's like rooted in your family and connection. And then it's amazing. You know, we got to do a bit of a tour and we'll talk about your practice later, but you really are making that come to life, which, you know, is so exciting. Any patient is lucky to get to come here because your servant heart that you have around what you're doing.
Well, yeah. And you know, what's so crazy is like, now we see somebody with a similar injury. I took care of a young man that had a very similar, I've never seen my dad's x-rays, but I imagine in my mind what it was. And like, you know, this young man had a bad injury and ended up getting like small incisions and, you know, like almost like a minimally invasive stabilization procedure and got up and moved immediately and, you know, like healed, right? And is like, you know, back in college now, right? And to think like where we've come, you know, from 1970 to, you know, 2020, when that happened, it was just, it's an amazing advancement. And it's really inspiring to think what would have happened to him, you know, nowadays, if that happened, would be totally different.
It's amazing seeing just the way that you've structured your practice here as well. The way you look at care and how you're trying to provide care. I think it's changing the paradigm a lot because we've talked about it a lot, but there are all these different silos and segments of where people get care. And it's tough to get to the place where you really need to get to. And I think what you've done, bringing that all under one roof, is something really special for a patient side of things and how care is provided.
Yeah, I think I was very lucky as I went through my training to see some very different models. And I had amazing mentors every step of the way. But very different ways of taking care of patients. And so I was able to see really complex surgery and very advanced spine deformity and revision surgery. I was able to see very elite care And as I started looking at what would make me happy as a surgeon and how I could take best care of people, I was kind of thinking, how do I meld that all together? And the great thing for me was, credit to, many, many people in front of me. When I joined, Dr. Schuler had founded, Virginia Spine Institute, and I joined a team that was up and running, right? I was the fourth surgeon, and very early on, our practice was different because we really brought together people with different training and actually worked together, right? I think so often the model is, okay, you have something go wrong, you go to this doctor, and if it's not what that doctor does, they send you to another doctor, and hopefully your reports follow you around. But it's really challenging for the patient to do that, right? And it's time consuming. And then you start to wonder, like, is this all getting talked about? And more importantly, like, is the doctor who said this aware of what happened to me down the road? And so for us, being able to have a lot of different experts of different backgrounds working together, all under one roof, this comprehensive care, not only does it allow it to be an excellent experience for a patient working its way through, but if I'm seeing a patient and then I have something that I'm challenged with, I bring in a doctor, maybe a totally different specialty, and then we examine the patient together, and he or she points out something about the hip, or I learn something and they learn something. And so as you do that over time, right, a rising tide raises all ships. It really is not only great for the patient to have this multidisciplinary team, but it's great for the people who are working there and to be immersed in that. And it really, it took me from being someone who came out as, I think, from a pedigree perspective, a really great orthopedic scoliosis training, but I knew nothing about rehab. And to be able to work with people who with different training and incorporate that into my practice has really, I think, become like the foundation for everything we're trying to do at VSI and what's really special.
Absolutely. And so you like you said, you grew up in Colorado, then you made the move out here for undergrad. You went to University of Rochester for undergrad and medical school, then spent 4 years at HSS, right? A slightly known institution out here, right? Yeah. So you got to spend time there. And then I'm truthfully curious what drew you to VSI, because like you said, Dr. Schuler started this back in 1992. So this had been around, you came into practice here in 2008, 2009, somewhere in that time frame. I'm curious because as someone trained at HSS and doing the things that you were able to do, obviously you have opportunities. And I'm curious what drew you to VSI over other practices or other opportunities that you might have had from what you saw here.
One thing I really was good at or lucky at along the way was finding tremendous mentors from day one in med school. Like, I went to Rochester, right, which is the home of the biopsychosocial model of medicine. What did that mean? They wanted to train primary care physicians and only primary care physicians. Like, they did not want anybody to go into a subspecialty. And here was this kid, like, I'm going to be a complex spine surgeon. And they're all like, I guess we got to let one in, right? But along the way, I was great at that. Some orthopedic person would be there, and I would want to work there. I would spend time in the lab. And as I worked with one great mentor after another, it was ultimately one of my mentors at WashU, actually one of my mentors at HSS, multiple mentors, but especially Hannibal Bawachi, who's a very famous surgeon, really was instrumental in helping me decide to go to St. Louis and decide to be a complex spine surgeon. And then one of my mentors at Washington University St. Louis went to Notre Dame with Dr. Schuler, and so they knew of each other. And what was interesting is I had learned complex spine surgery, and when I looked at VSI, I started to say, wow, he's been looking for years for someone with a complex spine scoliosis expertise and waiting for the right person. And when I asked my mentor, well, what about this guy? He says, he will teach you things that I could never teach you. He understands how to run a practice, grow, communicate. And I was sitting there like, oh my God, there's all this stuff that goes into being a good doctor that yet another mentor could teach me. And so when I got here, I told you, I had a great training. I had never seen a spinal injection when I came to VSI. And so to get here and learn about rehab and injections and non-operative care and the movement of the SI joint. And I mean, this to come to a place and work where, that had already been there and was going on before I started. And of course, by me coming and having that additional background that I'm adding in, I feel like, the goal was I elevate and they elevate, and we all have made great progress.
I think we see this with a lot of either new care or new technologies, that there's this hesitation to jump into them. And with you as a complex spine guy coming here, when you saw injections and, physical therapy at the forefront and things like motion preserving procedures, for you, was that a hesitation of stepping into that, or what really gave you the confidence to say, I'm going to lean into this and start having this be a huge part of my practice?
There's this balance between being a data-driven physician, a data-driven surgeon, and proving and knowing what you do is good for a patient, but also being able to look at an actual patient and make some decisions in the real world. And I feel like sometimes we can be hamstrung because it's impossible to get perfect studies. And in fact, in some cases, it's not really ethical to randomize patients to determine certain things, right? It's just not right. Mm-hmm. And so that's something that I feel like I've really been able to do well during my career. Say, okay, here's what I know. How do I take that next step? And how do we build? And, I would say, especially with some of the work we've done, we've been maybe a little bit ahead of the cutting edge. You don't want to be maybe on the bleeding edge, yeah. But we've been right there, right? And I mean, if you look at, we've done a lot of work in robotics, right? And we were, one of the first places in the country to use robotics in spine surgery. But we were able to say, okay, we know how we're doing it. How do we incorporate it in a way where it's an add-on, but we don't get into any trouble, right? And to be able to now have done that for, 12, 13 years, and be able to say, I've been able to do that and be part of the world firsts of some different surgeries that have never been done before, using a robot that's never been used before, and yet have been able to navigate that in a way where not only have we avoided something bad for patients, but we've been able to make the improvements and demonstrate that it's actually better for patients as we go.
Do you think that, just as you're talking, I just keep thinking, like, you have such a growth mindset, and that's kind of the basis of, like, at your practice of, like, I want to learn more. It doesn't seem like there's ego of, like, I know everything, which sometimes can come with, being a surgeon. Ego is important, of you're going and putting somebody in your hands. But I hear a lot of, like, humble growth mindset. Do you think that comes from the experience with your dad of, like, your just belief and patient perspective all the way through, and that's what's carried through? I'm really curious your thoughts on that.
I think any spine surgeon who tells you they don't have an ego is probably kidding themselves in some way. I want my fighter pilot to have a little bit of ego, right? But I think, I really, once I have a patient in front of me, it really boils down to that patient. And I think one of the reasons I came here, and one of the reasons I think I've grown the way I have, is my patients have a lot of access to me. I see them a lot, and I do non-operative care. I stick with them. I see these people, and I see what's helping them and what's not. And being in that environment and really looking at this person has gotten me to try some things that if I was just in a really high volume model where I was just doing the same thing over and over again, I wouldn't have been forced to push my limits. And whereas if we don't push our own limits, we don't know where they are. And so whether it's certain surgical techniques or learning about rehab or motion preservation, certainly being able to say, if I'm this patient, what do I know about this person, what they are, what they do, who they love, all these things, like, of the options that exist out there that are reasonable, there's no one thing that's right for everybody. What makes sense to this person? And sometimes there are multiple options that a smart patient, a smart doctor could choose. And that's when it comes down to, like, values and desire and risk tolerance, and that's having those discussions. It's time consuming, and it can be draining, honestly. But I feel like the better we do of going through the options and understanding and sharing those decisions with patients, the happier they are. And sometimes we're in a situation where there's, hey, we could try something little and we'll see what happens. And then or we could try something definitive and big, and both are reasonable. And if you go through that process and you really share that decision with the patient, even if you do the little and you need to do the big, they were a part of it. You're still working together. You still have a great relationship, and you learn so much by kind of sticking with people all through that path.
I think that's such a uniqueness to your practice too. And we talked about that a little bit earlier. And I love that concept of like, I'm going to have the conversation with this patient about what their goals are prior to us getting into that pathway. But it's a huge difference between someone who says, I want to start running marathons again, right? I haven't been able to do it for 5 years because of this injury, versus someone who says, you know, I want to play a little bit of casual golf. I want to play with my grandkids, right? Two very different scenarios. And I think the care pathway, and like you said, what you're going to do in that pathway changes, but having that conversation on the front side, I think, is so unique.
Well, even just we were walking in the hallway, you were showing us around, and I was surprised. You see a patient that you just saw, and you're pulling your cell phone out and have his images just up on your phone and able to have this quick conversation and how's your wife? And that is like, it's like small town. It's like what you remember of like small town concierge medicine way back when. It's like that was the feel that was given, which is so special. And I think your team said like new patients appointments are always an hour and a half. Like that you rarely ever get to. That's just so unique today. And it speaks volumes.
It takes a lot of people and a lot of effort. You have to see less people. You have to spend more time. I'm at the point now where I couldn't do it in any other way, right? Like I could not go back and see 50 or 60 patients a day. And like, I value that time too much. And I really appreciate being able to think. I'm definitely a think and a plan person, right? And I feel like the more thought and effort and whatever I put into an endeavor or a surgery or a decision, you know, the better control I have. I had a mentor who used to, I'm sure he felt like he could worry about a patient enough that he could prevent them from having a complication. And unfortunately, he shared that with me because I worry a lot. But I do feel like it really is there. Like you think about these people and what is it about this surgery that is the specific thing that we've got to avoid? The medical thing, the surgical thing, the technical thing, the family thing. And you know, you have to be in a model and an environment where you have the time and the desire to do that, right? And it's special to be able to get to know people like that and to really to be a part of it.
You know, obviously we have a big passion for motion preservation here. And we were talking a little bit about being part of the Simplify study and those aspects. But going back to the start, I'm curious, you know, I really focus on this concept of you being a complex spine guy and then like doing motion and some of these other things. That's not a super common thing to see. And I'm curious what kind of kicked you off in that motion realm of things, of whether it was cervical or lumbar, whether it was outcomes driven or research driven. What do you do to start making some of those first steps?
Yeah, because you're right. First and foremost, right, we have to take great care of patients, and we have to do everything we can to keep them out of harm's way. And to me, and at VSI, we really talk about customization for patients, right? We know that a lot of the problems that we have a genetic background, right? So if you look at how your body is going to hold up or the discs in your spine, you've got some genetics and we have no control over that right now. And then there's luck. And then there's some things we can control, wear and tear, health, fitness, etc., right? And so as we're looking at someone who may have multiple different levels at varying stages of problem or potential problem, we have to think not only what are we going to do now, but what's going to happen in the future. And we're always struggling because we're trying to say, what's the best treatment for the current symptom? What's the smallest thing we could do and safest? But what's going to last the longest, right? And sometimes those are very, very different treatments, right? But it's this genetic. I'm big on the genetic predisposition, and you know, both of my parents have had back surgery, right? So like I focus on this, but I look at that, and when I start to factor that in, I see the downsides of losing movement in your back, whether it's from arthritis or from getting fusions. And I say, boy, if there's a way we can combat that, we should. And there are times where we have somebody who has a level that is completely unstable and pinched nerves and they need a stabilization. But if they have 3 other problems above, I think one unique thing we do is we say, well, how do we customize, right? It's not you have 3 bad discs, you need 3 fusions, right? Can it be, you know, fusion, replacement, observe? There's a whole way to customize all of these things together so that we're trying to get the best overall success for people while also preserving the most function that they have.
It sounds kind of like, you know, a lot of times fusion is the first option. It sounds like you fusion isn't the first option that you're going to for your patients, or not every patient. You're like, what other things can I do? And is fusion the last option you go to? I'd love to kind of hear your philosophy around that.
I always say one of the biggest mistakes I think patients and surgeons make is choosing the treatment they want to have over the treatment they need to have. So when I'm looking at a person, I'm looking at what they're feeling, what their symptoms are, and what their structural problem is. And so you really have to, be honest and open about that. And that's where I think having an experience of saying, okay, I really feel like I'm very comfortable with a spectrum of treatments, from something super complex, scoliosis, redo surgery, to very straightforward physical therapy and everything in between. So when you really look at a problem, you can say, in this specific circumstance, what's best for you, and really start to experience, share with the patient, and help them understand that, right? I mean, like I had a patient come to see me from out of state today, certainly because I'm a motion preservation guy, right? And the reality is, person has a really unstable problem in their back, bad pinched nerves. They should have surgery, and it needs to be a fusion. And, I'm going to recommend that directly, right? I see people who try microsurgeries in the setting of instability, and so we can't set ourselves up for failure. We can't let our desire to do something small prevent us from doing something right. But when there is an option to do something smaller, or motion preservation, or whatever, obviously, if a person is a good situation for that, I always want to gravitate toward that, as opposed to, something with more limitations.
The question that I have, and what I'm kind of curious about, is we've seen motion preservation everywhere else except for spine for a long, long time, right? So we have total joint replacements in the knees, in the hips, and in the shoulders, and in the ankles. But there has been a lagging effect of that in spine. And obviously there's biomechanical challenges and other things. But I'm curious why you think that is, that spine as a specialty is kind of lagged behind, right? Because if you walked in, you blow out your knee, and someone said, we'll fuse that right up for you, you would walk out and laugh, right? But in spine, we've been doing exactly that for 30 years. And not because products have been around and we haven't adopted them. Now we finally have some products and some data. But why did it take, what is the lag period for that? Why is that?
The reality is, with all respect to my arthroplasty colleagues in the knees and the hips, the spine is complex, right? I mean, imagine a roller coaster with over 30 cars on it, and each one is attached through multiple bearings and all these electrical cables. And boy, it's way more complicated anatomically than a knee. And the reality is, running in the middle of all these bones and joints is like a spinal cord, right? Or delicate nerves that you can't touch, right? And so the reality is, the challenges of how to safely preserve movement have been a holdback. But I also do think, in many cases, super well-meaning, but our desire for ultimate proof before doing anything have held us back. And the reality is, a disc replacement surgery has to be more technically precise. You have to be a great carpenter. It has to be aligned perfect. It has to be in there right. You have to choose the right patient. It takes more time to counsel and prepare and do that surgery. And if you look at my generation, I was trained in some disc replacements. There were a few FDA kind of patients I saw during my fellowship, but most people in my generation either got trained and never got an experience to do them from a lack of insurance authorization, or older surgeons were never trained. And there's all these barriers to say, well, how do I start doing that? And to me, it's looking at that patient in front of me who I know is a perfect disc replacement, even though I haven't done many years ago, and saying, this is the one, right? I learned how to do this. I'm going to review this situation. I'm going to talk to my mentors who've done this. I'm going to do that. And when you do that disc replacement and you have every confidence, that's a perfect one, and it goes well. And then you start to build your technical precision, and you build your proficiency, and you build your confidence, and you start to say, okay, one simple one can go to 2 level. We do combinations with fusions and disc replacements and customization, right? And you shouldn't if you jump into some big thing like that without the right kind of experience, you're not doing right by your patient. But over many years, I mean, that patient we saw today, I mean, rare. I don't want to act like I'm the guy who do 4-level disc replacements on everybody, but that gentleman, that's what he had and what he needed. And that's something that we went about very, very safely, but it's looking at the patient in front and saying, gosh, if we got spine problems in my family, right? Every year I'm in practice, I become a bigger advocate of motion preservation surgery. Every year I move closer toward my own back surgery, I become a bigger advocate in motion preserving surgery, right? Yeah. And I look at that, I'm like, okay, what would I want if I were you, right? And one of the pivotal things, and Dr. Schuler, my mentor, has talked about this, right? He's had a neck surgery as, an elite, world-class spine surgeon. He knew that having multiple levels in his neck all fused together might have been the end of his career 10 years ago, right? And this was pretty early in the hybrid evolution, and we ended up doing 1 fusion, 2 replacements. He's talked about this all over the web. It's, and he was able to preserve his movement, and he's still operating today, right? And you start to say, wow, that was a case where we really pushed our level of comfort because we had someone we had to do that. But then I start to say, I learned so much from that one surgery that I've then applied to all the other patients that have come afterward, right? And that's where you want to incrementally build and do those things safely.
Talk about putting your money where your mouth is. I don't know if he did the very first one, but I know he did one of the first hybrid cervical cases himself on a patient. And then he had his own done only a few months after that. Yeah. And if that's not putting your money where your mouth is and supporting that, I mean, that is, because to your point, that's what the conversation should be, right? You've been able to build your practice on this concept of you saw what your dad went through, right? Mm-hmm. So every patient is like, well, if that was my dad or my mom or my brother or my sister, what do I want them to go through? What would I want for them in 5 years or 10 years or 15 years down the road?
I think we might debate who did the first hybrid surgery just to keep the ego going on in there, but we'll give credit to Dr. Schuler for today. But no, it truly was very much something that nobody had a lot of experience with at that time. But I think that the experiences that we have personally, really, really guide us. I've talked about my dad's injury back in the 70s. The reality is my mom's had multiple back surgeries, right? And has been through a very, very challenging situation. And being involved as a son, as kind of the doctor, as the friend of the colleague, it's really opened my eyes, right? And it's shown me, do you decide to do something small and there's ramifications if that doesn't work? If you do something big and that doesn't work out, there's ramifications. I would say the experiences that we've been through personally, Dr. Schuler, my mom and her, my mom has ultimately had her entire spine fused together as part of a scoliosis surgery, and has had some real challenges with that. And so going through those things has really evolved who I am and where I am. And I still do huge surgeries, but I'm very cautious with what I want to give you the best life possible for as long as possible. And what are the odds? What are the chances that this is going to go the way that we want? And I think that's what it came down to for Dr. Schuler was, hey, I did this hybrid. I believe in it. It makes sense that if I can fuse one and that works, and if I can replace one and that works, and if I have one that needs to be fused and one that needs to be replaced next to each other, why wouldn't that work? I understand we don't have an FDA study proving that yet, but right, intellectually it makes sense. And certainly if that's my body as a spine surgeon who needs every bit of movement to do surgery, we're kind of our own guinea pigs. I can certainly vouch for that.
That concept that you just brought up is, we don't have an FDA study to prove this, but we know in theory this should be the way that we do it. And I think it's part of walking before you can run. When we had Dr. Kachatarian on the podcast, he talked about this concept of probability versus possibility during surgery, right? So if someone comes in and they say, what's the worst case scenario? It's like, well, worst case scenario is you could die on the table, right? I mean, like that's the worst case scenario in any situation where you could become paralyzed. Now, is that a likely scenario? Absolutely not, right? The highest possible probability is that this goes really well, you get back to functioning, like you have a good recovery. And I think a lot of what we do, I think there's some hesitation out there because you talk about your 4-level cervical, right? There's not reimbursement for a 4-level cervical right now, and there's not an FDA study that proves some of those things, but why shouldn't it work, right? If we can still provide that stability, we can still provide the motion, there's no reason that shouldn't work. A little bit of it is walking before you can run. So you do a 2-level. Okay, 2-level works well. Okay, we're going to do a 3-level. Okay, that works well. Like, let's try a 4-level, right? And you see some success and then you start working through that. Have you kind of taken that approach of, walking a little bit before you can run and seeing, I have success here. Now let's try success here, and let's try success here through your practice and through your time here.
Well, yeah, I mean, absolutely, right? It's funny. Part of it just depends on what you're comfortable with. I remember we got the robot in 2012, and nobody had done any robotic surgery around here. And the very first surgery we did was a wonderful woman who had unfortunately had a fracture and needed what was actually a pretty complicated surgery. And I was like, that's it. And everybody was like freaking out. We're like going to use the robot first case in the area. But the reality was, I was like, as somebody who was used to dealing with pretty complex spinal anatomy, I was looking right at it. I knew I could do it kind of in my sleep. So adding the robot as an adjunct tool, like I was already doing everything I normally did and it was there with me. And so we did something really, really complex, but adding it, like if the thing had turned off at any second, I could have kept going without any delay, right? And so you start to use these things in kind of those kind of situations where you're like, hey, I know I got this, right? And especially as a huge proponent of technology, I believe that we can use technology to plan better, make better decisions, execute better in the OR and outside the OR, and to elevate all surgeons, right? And I believe, and that's why I do the different things I do in technology, whether it's robotics or augmented reality or computerized planning, I believe that is really a path to get a better standardization of treatment so that different surgeons and different patients all around can get elevated levels of care. But as you're doing those things, especially when things are new, you have to put yourself in a situation that if the thing turned off right now, I could still forge ahead without it. And eventually it gets so good that you don't have to do it without it, right? But that's a lot of the stuff we've done with technology is I always have here's how I do it with no technology. I could do it that way. If you think of the analogy, right? Like back when they started using cameras to take out gallbladders, they used to do it with a big incision and they started using the cameras. And initially it took them longer with a camera than with the incision. And the traditional surgeon's like, oh my God, it takes you twice as long. What a waste, right? And then people started saying, yeah, but people are recovering so much faster and it's less invasive and lower infection rate. And then they'd say, well, what happens if the camera goes bad? You still have to know how to do it the old way. And that was totally true for a period of time. The reality is that time has passed, right? The camera doesn't go bad. We have extra cameras. Like you never need, essentially never need to convert to the old way as the technology improves. And so a lot of the things that we're doing here, there's going to be a generation of surgeons who actually doesn't learn how to do it without technology not too far down the road because the technology has become that dependable, right? Then astronauts are just sitting there pushing one button, right, on a touch screen because the technology has advanced so much that's the safest thing for them.
I'm curious, talking about that, you've been in practice about 15 years, correct? Just that evolution, where you see we are in spine right now and how technology is moving things forward. I'm curious your thoughts on that of just comparing and your thoughts on where we are as an industry right now.
I think it's an unbelievably exciting time. And I think we're seeing a real transition away. Yes, it's great to like come up with a new thing, right? In spine surgeons always use the word widget, right? A better screw or a better this or that. But a lot of what we're doing now is really based around data and making better decisions and making better plans. And while I'm at the point now where like we essentially always are using, if I'm doing like a fusion case, I'm using augmented reality to put my screws in more safely or robotics or something. But I see all these technologies that have been evolving in parallel meeting together in a modern OR, right? Where we're doing electrical testing of nerves and robotic guidance and visualizing with cameras and a heads up display like a fighter pilot. And all these things are all going on together. And we're not there yet, but I see this additive future and everything that I'm trying to work on, I actually like see them all together by the time I'm done. And I think that is a way to take the entire decision-making process to do surgery, what surgery, how do you execute it, how do you follow it up, and make that as as streamlined as possible, right? You look at the videos of these factories building cars, and it is unbelievable, the accuracy and the speed at which these things are happening, right? And obviously we're never going to get to that level in a spine surgery, but improving our efficiency to that level is a big passion of mine. And if you look at it initially with technology, we put in implants. And the implant has to hit a bullseye every time, right? There's a bone, there's a spinal cord, there's a nerve, there's a blood vessel, whatever. I got to hit a bullseye every time. Initially, it was all about accuracy. Can I be accurate? And all the studies were on accuracy, which is great. But we always assumed accurate meant better. Well, one of the greatest studies I'm most proud of doing was one of the first studies that looked at this with robotics, but it looked at accuracy, but it actually looked at, what about the patient? And looking at saying, if we use this, does the patient have a better outcome? Meaning, what's their risk of a complication or the risk of needing another surgery? Because I care about that. The reason I care about accuracy is because of that. And that was where we've really started. And now a lot of things we're doing in the field have moved over in that direction, right? And when we first did this study, this was doing minimally invasive fusions. And sometimes we would use a robot to guide our pedicle screws. Other times we would maybe do it with a fluoroscopy, like a live x-ray machine. And honestly, this is a long time ago. In my hands, I felt they were basically equivalent. So we decided we got to get some data and understand this. And so a group of surgeons got together, and like most of the time, there were some surgeons who believed in the robot and some who didn't, right? And they were each in their group contributing patients. And I was in a very interesting position because I used both. And and so when I was talking to patients, I actually offered patients to choose to be randomized in my little arm of the study. And I would tell them, here's the thing, we're trying to figure out which one's better. I use both. I don't really know. I think they're both great. And so I was actually I was the randomizing arm in this study. What was interesting was the very first time we unblinded the data and looked at it, I ethically had to quit randomizing, because the patients who were getting treated with robotic surgery were having such a better outcome than the other ones. And so I literally stopped randomizing as we finished the trial. But that was a really important thing for me, because when we get to the end, to be able to say, hey, I know that in my hands, if we use this, I can make your surgery safer. You have a lower risk of a complication, which is what we all fear. You have a lower risk of needing another surgery. Those are the things that matter. Patient quality of life outcomes. And if you look at the future, we're going to be measuring, we're all wearing something, right? We're going to be measuring people's quality of life and their outcomes with watches and, different electronic devices to really understand the different treatments that we do and how they affect people. And that'll help our decision-making as we go along.
Well, in an ideal situation, we're agnostic towards the type or the way that we do it. We only care about the outcome. Is the truth about in a perfect society? Now, there's obviously incentives involved, and that's never going to happen. But the hope is that it doesn't if a robot works better, great, we'll use the robot. If an implant is your best solution, then we'll use an implant. If a non-instrumented procedure or therapy is the best, we will use that. But they're all objective, data-driven points, right? On, well, why do you use this thing? Well, my patients seem to do pretty good. No, not my patients seem to do pretty good. We have less blood loss. We get them returned to work quicker. And, that's a question that I have for you. I think you're doing it here, but across the board, are we measuring the right variables, right? Because we do all these questionnaires and all these things, but the truth of the matter is, when do they get back to work? What are their goals? What is their quality of life? And are we looking at the right metrics when we're trying to measure some of these things? And that's a very complex, loaded question, but I'm curious what your thoughts are on that.
It is hard. So the answer is we are trying, but it is far from perfect. It is really, really challenging to keep track of people. It is challenging if they're doing well to get them to fill out things, even if you're doing it unobtrusively, texting them or, hey, it's Dr. Good via video, please just click on this, and you don't even have to come into the office, right? And so that has always been one of the things, I think in medicine it's challenged, but especially you start talking about surgical studies, it is really, really, really hard. And that's where the hope that, AI and data collection and all this will give us a much different insight into the success of the different treatments that we may do. And there's a huge need and there's a huge pressure in all of medicine as the goal is just keep costs down, right? I mean, that's like priority one, right? Is cost control, more care for, more people, how do we do that with less cost? So we're really going to have to continue to prove what works, and we're going to have to be fighting to advocate for what we know works, or we may not be able to offer to people.
So there's a question for you I had that we talked about a little bit previously. And I'm curious how important it is to find someone that, when we talk about these different techniques, right, whether it be robotics or endoscopic approaches or motion preservation approaches, finding someone that is a specialist in those areas, right? And I think, the example you gave earlier is if someone tells you need a fusion, you want to make sure that that person also has in their arsenal other options available, right? And if they only do fusions, then how do you know if that's the right option for you? So when you're looking at that, if you went and got a disc replacement, you're going to want someone that's doing 500 of them a year, not 5 of them a year, right? And I wonder if we're going to see this kind of specialist, a trend towards specialists like we see in knees and like we see in hips, where that's kind of what they focus on. Do you think we'll see some of that in spine as well? And for both ortho and neuro guys, do you think we'll see that in spine where guys start to specialize? That's the first question. And the second question is, what's the importance of finding someone that is well-versed and specialized in these techniques that you're looking for?
To answer your second question first, I think it's critical. We're humans. I don't hear from patients, this surgeon told me a fusion is my best option, and they don't know how to do a disc replacement. No one says that. I do know that I sometimes am aware of these people, and I'm aware that they've never done a disc replacement. Now, I don't say that, right? But whether it's we don't know what we don't know, our own good intentions, egos, whatever, can get in the way. And so I don't think that we are good at saying, I'm a T-lift guy, I'm a fusion person, that's what I do. I don't offer that other thing. I think patients get the impression the surgeon knows all about both. And if you're really only someone who really has one, I'm not sure that gets as well communicated as it should, right? And I think asking from a patient perspective is important, but I think getting a full understanding of the breadth of someone's technical skill set and practice is hard. I do think, I think if you're getting an opinion for a fusion, you want to be asking, what are the other options? What are the motion preserving options? And I do think you want to be seeing someone or getting a second opinion from someone who believes in that and does in that every day. And I saw a patient today who I've mentioned, traveled to see me because she knows I do disc replacements and believe in motion preservation. And I told her, here's what you need. It is a fusion, but the benefit, and she wants to come have her surgery even with me, a fusion from another state. And now she knows she doesn't need to worry. She's not missing out on something because she didn't get the right information. And I do think it's really important to make those, educated decisions ahead of time. And sometimes it's hard. You're miserable, right? Things are hurting. You just want it to go away. And that can be the hardest time, to take your time and get opinions and get educated. And sometimes, you're not maybe in your best mindset, but I think it's really, really important. We definitely see, people who come in and in retrospect, in my mind, I'm like, wow, I think that person would have been a great candidate for something smaller or something motion preservation. And now maybe we've burned some bridges. In terms of the specialization, I think the answer is definitely yes. And as we get to more specialized things, particularly motion preservation, endoscopic surgery, and as we get even higher level having been a robotic surgery, user for, 12, 13 years, like it's a totally different way of doing surgery. So there's going to be a need. The challenge as a surgeon, as a patient, is say, okay, like if I only do endoscopic surgery and you're in front of me, I want to make sure I don't fall back into the old trap of everything looks like a nail. And so that, I think, is a place where, as a practice, we want to be sure that we have high level this and that and the other thing. And the reality is, if what somebody else can do is a better option for your problem, I need to be able to know that and get you there. And that is a little bit of a challenge within practices, within big universities, within solo practices, because we're not going to get to the point soon where the technology makes all surgeons equal. And we're not all going to be as good of an endoscopic surgeon as a disc replacement surgeon as a XYZ. And so I do think that being more specialized is really important. I mean, I think spinal deformity is the most clear example. Used to be, it was like high risk OBGYN. You have spinal deformity, no one will touch you. You need to go to someone who's an expert in that. And it was really a very different skill set and plan. Now, that's kind of actually changed a bit as some technologies like robotics and navigation have opened up deformity surgery to a larger group of surgeons to be facile with it. But we really have to deal with that. Now, the good news and the bad news, but the good news is patients now have access to information like they've never had before. And patients are learning about their doctor before they ever meet them. So many of my patients roll in. I know all about you. I mean, you mentioned it. I know Griswold. I know about this. I know about that. How was the Easter egg hunt? You're my surgeon.
You eat a sandwich on Tuesday.
Like we've built this relationship through social media and I think that patients are now using support groups and chats and all of these other things to find out, and they're getting tremendously educated. Now, the hard part is it's hard for a patient to look at what another person has and say, is that person's problem the same as mine, so I can really compare notes? That's, I think, the hard thing when patients are sharing their stories. But patients come in really well educated. They know their options. I mean, patients come in, they want to talk about this disc replacement versus that one, bearing surfaces, constraint of implants, densities. And I think in general, I embrace that, because if I have someone who is that engaged in their care and as long as they're willing and able to come to a decision, and because they have to ultimately put the trust in the surgeon. But when they get to that level, I'm like, great, let's talk about this, because we're going to have you so prepped up for your surgery and making the best decision. I think it's awesome. And that's where the more we can do things like this, and if I can get a message out to 1,000 patients that I'll never even meet or help, but it helps them learn something, ask the right questions, or if I develop some technology that some other surgeon uses that makes them better, like that's how we just help people we're never ever going to meet. And I think that's the answer for the digital second opinion and helping patients find access. There are regions of the country where you just can't get things that I do every day. Or, I mean, if you look at Canada, patients, I go to Canada frequently, I teach robotics up there. The access and the options to people there are very, very different than here. I've met people waiting over a year with horrible sciatica because they can't get a microsurgery. And so being able to reach out and help those people understand and learn and give access and travel, I mean, it's a tremendous opportunity to really kind of, give everybody access to really, really special and elite care and good decisions.
I think it's really interesting. I agree. I mean, I'm looking in these groups on a daily basis, and they are sharing information with each other. And I think as an industry, we maybe are a little behind on how much credit we give to patients, on how much they do know or how much they are willing to do research and like read research papers and highlight things and come with all this information. I'm curious, in your practice, you've really taken that and said, okay, I'm going to meet patients where they are. If this is happening, I want to make sure I'm there. I'm curious, one, how that has been for your practice, and two, if you feel like as an industry, we're behind in kind of meeting that demand or meeting patients where they are right now.
I definitely think that we are. And I think that some of our best and brightest and a lot of our thought leaders are focused on teaching other surgeons, which is a tremendously valuable endeavor. But I think it's a very different skill set to be able to talk to people in language they can understand and make things clear. And some of our most intelligent thought leaders are not focused in that area. And the good news is I can certainly say a lot of those people are working with people who are skilled in that to come together, right? A lot of our spine societies have tried for years to reach out to patients, and they've realized like, hey, like that we haven't done that as effectively as we would like. So, for example, a nonprofit organization that we've worked with for years called the Spinal Health Foundation, right? And empowering patients through knowledge and hope. And they are really now starting to become the voice of doctors, multiple societies coming together. And these are not doctors. These are patients who know how to write and speak and talk to people. And so I do know that there's this strong desire. And I think on the industry side, what patients want and ask for and demand in any industry is going to drive the industry. And it's no longer about convincing a doctor my disc replacement or my knee replacement is better than that knee replacement, or it's faster, it's easy to put in. I mean, that still certainly exists, but I think it becomes more and more and more about industry to hospital systems, industries to patients, right? Direct to consumer marketing. That's not a word you use in medicine, right? But it really is starting to become about that. And I think that will ultimately, someone who believes, kind of in, America and capitalism and, whatever, I think that will drive quality and success, because we have to do that to get the patients to choose where they go. And so the companies that don't do that will be left behind.
And when you talk about, because you're on the board of the directors at is it National Spine Health Foundation? Is that correct? Yes. So you're on the board of directors there. And I think the concept that you talk about is this access to information. Yeah. And it just hasn't been around for a long, long time. And we're finally getting to that place. We get to that place from pieces like this, right? Driving the National Spine Health Foundation, driving educational aspects. And that's actually how we drive some of this care forward, right? So when you talk about robotics or motion preservation or, AR, VR systems, those things don't exist in a patient's mind unless they're educated on those pieces, right? And you talked a little bit about, patients are coming in with this new knowledge, new awareness. I'm curious how that's changed since you started in practice. The amount of information that patients are coming in with, and then what are patients demanding? Because patients are starting to demand a level of care. And like you said, that's kind of what drives industry, right? Is patients come in and say, no, this is what I want. This is what I read about. And if a doctor doesn't provide it, once you get enough patients that say that, they say, well, I have to figure out how to get this into my practice. I'm losing all these patients. Has that been a big change on what they used to ask for, back in 2008, or if they asked for anything in 2008, and where you're at now in 2024, 16 years later, what that demand has looked like and what patients are starting to demand from their care?
I mean, it's just completely different. But the reality is that's not just what the patients are asking for. It's what exists for them to ask for.
Absolutely.
Right? Like in 2008, the way I would address problems, many problems, is completely different today. Right? And so there are more different things to think about and to ask about and to inquire and to learn about. And as a surgeon, there's more things to you have to love learning and evolving, and you have to keep doing that until the last day that you're in practice, because things are moving and you owe it to your patients to stay current. I can't be doing if you're doing what you did when you left your training, I think that you're probably not doing as good of things for your patients as you should be. And so I think it's just completely different. And I do think if you look at what's going on and people are using artificial intelligence, right, to ask questions and to figure out their problems and to come to me. And if you look at the rate of change of knowledge of our society, it's kind of mind-boggling, honestly, where it's gone. And we haven't even scratched the surface of where I think it's going to go. I think at some point we're going to look back and be like, we used to cut people open to fix this,
Absolutely.
That is in sight. And as the computers are just churning data in a way that is just mind-boggling to almost all of us, we're coming closer and closer and close to that. And to me, it's a little terrifying, but it's also just it's so inspiring. If you look at my dad's surgery in the 70s to what his surgery would be today, to what it will be 30 years from now, we're almost like Star Trek, put them in a thing and shine the laser and they get up and walk away, right? It's crazy how inspiring that rate of change is over time.
I love your quote on, if you're doing what you did 20 years ago, you're way behind the times. And truthfully, what I want to talk about a little bit is the practice that you've built here. I want to talk about VSI because I think you are putting exactly that into action on what you've built here. And I'd love for you to talk a little bit about, you just went through this rebrand in the last few months, why that is, why you went through that, and then the different components of care that you actually provide here keeping up with the times of what patients are demanding in care?
You know, obviously so passionate about this, and this is currently like my responsibility and my focus. And you know, when I always like bring up the quote, like, you know, when you drink the water, don't forget who dug the well, right? And so like this place was here a long time before I got here, right? And a lot of people, there's 100 people who work here that are all a part of this, and you know, our founder and doctors before me, right? And so I'm excited by what we're doing and what I'm hoping to do moving forward, but it's all about that foundation and that history. And I think it would be impossible to start today and build what exists here, given the current environment and the world around us. And so I'm so thankful for that history and that tradition, and I want to protect that. If you look at what we started as, it was mainly a spine surgery driven practice with some physiatry, pain management, and then therapy grew, and over time it's expanded. And so as I'm looking at the future, like I'm not trying to like blow it out and go big, but our patients are traveling from all over the place, and we've grown beyond Virginia, right? We've grown beyond just the spine, although I am a spine doctor and always will be, and that's my pride. And so our goal in terms of what we're doing is to try and communicate to patients really, really clearly. And so that's where simplifying to VSI in terms of our messaging for the world, I hope keeps that history, that rich tradition. And, you know, God, I don't want to jeopardize that. But it's also a way to really open up to patients who are traveling from so far away geographically. You know, we've got 3 major airports around us and people are coming from everywhere. I don't want that to be a limitation for people to be able to find and get access. And as I look at the future for us, that was a big part of it. Another focus that we really decided when we looked at who we are is we looked at every practice out there and what everybody's saying. And there's a lot of like, we've done a lot of world firsts. I'm very proud, right? I love to talk about it. I love what we've done for patients, but it's like, it gets to be a little like, what about us? I did this, you know what I'm saying? And so we decided to try and change our culture or evolve our culture to be more about the patient. Let's talk about the patient. Let's talk about what the patient can do, right? And that's where a lot of our movement has been. And if you look at it, our patients are on support groups. They're getting, you know, we're trying to build a community, and it actually starts to seem that patients are as interested or more interested as what other patients have to say, maybe beyond what I just have to say about what they're going to go through. And so as we went through this, we really started to say this message needs to be about patients. It needs to be about patients. It needs to be about their victories. So VSI, we've come up with our victory logo, but it's also starts to be about what is it that matters to you? If I'm going to think of a treatment for you, I need to understand who you are, what do you need to do, what do you love, what are our goals? And really, if you really start to learn about, you know, happiness and gratitude and achieving goals, right? Well, we're much better off, like, if we actually talk about these goals, set them, talk to people about them, and we're much more likely to actually achieve them. And if it's just there's studies out there. If you just write the thing down and tell somebody about it, you're much more likely to get there than if you just know it in your head. And so part of this is to help patients when I'm meeting them. I want to get to the point where every patient I meet, what's our goal? And when you set those goals and you set them and then you achieve them, then that's a celebration. It's a victory. And the more we are gracious and have gratitude for the things we have, the happier we are in life. And we're not all going to climb Mount Everest, right? But if we have a goal that you're getting to your kid's graduation, I want to travel again, whatever it is, like being able to set that and achieve that and celebrate that, it brings so much happiness to people. And if you're telling that story to somebody else, that's a really inspiring kind of, you know, environment to be in. And another big thing here, we have 100 people who work here. Not all of them see the patient every day. They're not all in the room when I get that big thank God for you hug, but they all were a part of how we got there. And so these stories are really a way amongst our team for someone who did the initial phone call with that person, right? Or did the blog or help them with their insurance authorization. It's a way for all those people on our team to celebrate and see the value of what they're doing, right? We all want to like do something important in our lives. And so I think that's just so kind of fulfilling to be able to share that vibe and share all those stories amongst everybody on the team.
It reminds me of this story about NASA back when they're first trying to go to the moon. And someone was doing an interview of people who worked there, and they interviewed the janitor and they asked, "What do you do here?" And he said, "I'm sending somebody to the moon." And I think that's exactly what you're saying here. And I think that's so true.
Totally going to steal that. I've heard it before, but now it's on my list.
Yeah, no, but I mean, that's exactly what I thought of. And I mean, you really talking about where your practice started and where you are now, it's such a natural evolution and focused on the patient of this customized care of like, so often we're like, here's a box in medicine. We're like, this is the box. If you don't fit in this box of what I know, then I'm going to like whatever. You're taking the box and you're making it bigger and you're thinking about the whole body. And I think that's like, it's all we wish for care, you know, like, and it's exciting to see the passion that you have that can only be, you know, from the top down. I can only imagine that's so exciting to work for. And I'm in marketing, so seeing your rebrand gets me really excited too of like, you've got to meet the patient where they are. And we so often forget that. We get focused on I, me. That's really hard for a patient to be able to connect to. So saying I'm going to take an entire practice and rebrand it and make sure it's focused on like, who is the patient and let me meet you where you are. That's the ultimate goal.
I'm glad you like it. We literally, we just spent a tremendous amount of time and we literally went through we made patient personas. Who are the different types of people we see? And we literally were like, you know, the injured college athlete. And what does that persona look like? And, you know, the grandma, you know, this and the injured railroad worker, for example, right? And we spent so much time really trying to like figure out, because each of those people have very different needs and desires and whatever. And then how do we really try and set up so that we can identify and talk to, you know, each of those people, right? And so I think that's really the foundational, you know, part of what we're trying to come after.
And I think it's great for patients to be able to hear that too, of realizing how much work goes behind the scenes, even just for them to be able to show up and have this type of care of, like you said, it takes all 100 people that you have here to be able to provide the experience that you're having individually with them in that room and then in surgery. There's just so much more that goes behind that to give this level of care.
Yeah, no, I mean, there's no question. We're all just so lucky to be involved, right? And the things that we're able to help people achieve, I think I go home with stress and I go home tired, but I think I go home with, you know, more than my share of like fulfillment and, you know, for the things that we're able to do. Right. And so I think that's why people go into medicine. Right. I mean, that we have a team of young people who are all here and they're all going on to higher education, higher achievement, leadership, and that's why people, I think that's why you go into certain professions, and I think that's ultimately what's behind it all is the fulfillment of really truly helping someone and that seeing that difference in their life, and the thank you is very special.
The patient-centric nature is so prominent here. I mean, with your rebrand, it's on your podcast, right? It's on your social media. You guys talk about it. It's on the walls here.
All over the walls.
It's on the walls here, but like you said, we stopped a patient in the hallway. I mean, like the patients feel that. The one thing that I'd like you to touch on, you know, here just to wrap this up is the different, you said, you know, Virginia Spine Institute is not just a spine surgery practice. Can you talk about the different components that are all here at VSI under one roof, and then the importance of the providers working together with that patient, knowing what treatments they're going through, knowing what they're getting tested for. And like you said, I can walk down the hallway and ask someone, what do you think? I'm a little stumped by what we should do here, what this patient's going through. What do you think might be a good option? And the importance of all of that working under one roof with all of these different specialties you have here.
I think from an individual patient perspective, having access to multiple different experts in different areas all at once is tremendously valuable. But I think from a bigger picture, having a bunch of people always working together and communicating and teaching each other is globally elevating, right? And we have a teaching conference every Friday. So this morning we had, 10 or 12 physical therapists, 10 or 12 physician assistants, whatever, 8 doctors, 20 medical assistants, all in a room. And today's topic was cervical spine, and a patient with a challenging neck problem that went from not only what was wrong with their neck, but to concussions and headaches and car accident legal issues and how to deal with that, and psychological distress and depression, right? And to have a whole team together and have the therapists who are working with that patient and the surgeon who ultimately eventually treated that patient, and and what about this, and how do we optimize that? And hey, it's important if somebody's in a car accident, we know we're documenting all of these things because they're going to be important for us to understand down there, and to get everybody together in that environment is just really, really, really special, right? And it's all the time where I'm examining someone and I'm thinking, gosh, we see all these overlapping problems, right? The body's complex. Is it the brain? Is it the neck? Is it the blood vessel? Is it the shoulder? And to be able to grab somebody else and be like, well, you examine them. And they always come in and do a different exam than I did. And I learned something. And the patient is blown away like, oh my gosh, they just went and grabbed this person, or I'm getting these other opinions. But then I'm learning, I'm teaching. And that to me is a really, really cool environment. And I worked in departments where you had great orthopedists going together. Awesome, right? I never got a lot of exposure during my path before BSI with physiatry, rehab, neurology, pain management, and hey, we're going to do an injection. Well, oh, I just need a simple injection. Well, there's a lot of different ways you might point the needle. What target are we going after? Let's get somebody who's an expert, and we all learn, hey, how should we order that? Do we pick the right level? Do we come from the middle, from the side, coming from below? And that is just like a constant, exchange of ideas that is really, really palpable. And you saw, like, upstairs we walk and I'm like, well, there's the physiatrist, there's the anesthesiologist, there's 2 surgeons, and PAs everywhere. And as we're all doing this, it's not, thank God, every patient doesn't need every one of those people, but it turns me into a better doctor. Even if I'm the only doctor that patient needs, I'm more likely to know what I can offer. And so if you look at what we're trying to do, right, we are a spine practice at heart. And as we evolve, we're not trying to immediately become shoulder surgeon experts or whatever, but it's natural. And so that's where our growth is. And the key is like to keep that just in that sweet spot where we have everything that we need, and slowly make sure that everybody that's added to the team brings something new.
It's tangible, and the multidisciplinary team you've created here, it's impressive. I mean, you see it through the hallways, you see it through the whole building. It's amazing. So what you've done professionally here at VSI is incredible. One thing I'd like to wrap on is personally. I know you've worked a lot in the health and wellness realm and doing that journey for yourself and your family. And if you want to talk a little bit about G5, I've heard you even have your own logo for G5. So if you want to wrap on that, not just doing it here professionally, but bring it back into your own life and how you integrate that into your own family and your own life.
Honestly, this kind of stuff comes up in so many of my patient visits. Like today, I saw somebody, I've been following a scoliosis for 10 years. It hasn't changed, right? And I walked in, I said, your curve looks great. I could say goodbye to you right now. You'd be happy. The reality is we look at height and weight. It comes up with a BMI, and the person's in real trouble. And it turns out their body mass index is causing them to have prediabetes and sleep apnea, and is going to be much more likely their back they don't need anything right now for their back. But in 10 years, they're going to be in much worse shape, right? And so I end up finding myself in this entire discussion with this guy. Nothing, he doesn't need surgery. He feels fine. But we end up talking about intermittent fasting, weight loss. We talked about the new injectable drugs that are out there. We talked about, all different kinds of factors in terms of fitness and core strength and health, so that he lives longer, and so that back hopefully doesn't, I'm trying to put myself out of business here. So hopefully he doesn't need anything down the road. And if you look at, there's so many things that we can do that if we do them now, we can change the future. And I'm so big on this because I'm focused on the genetics, and that comes from me because my family, right? I know what my risk factors are, right? Like, we make bad decisions, we fall off things all the time, and we have bad backs. And so I think if you look at our family and G5, it's an extension of that, really. I started to say, gosh, being a complex spine surgeon is grueling. Many of us don't get to continue that job beyond our 50s because spine surgeons have tremendously high rates of back problems, disc herniations, you name it. And we die of cancer from radiation. And so I started to say, geez, if I want to still be able to do this, and all my mentors that I know who are still going, they are crazy fit. And so in my own personal journey of trying to say, okay, how do I get that? And learning, like, most surgeons are like, oh, I'll sleep when I'm dead, right? Sleep is for the weak. Well, trying to understand, if I think of myself as ultimately, I need to hold myself accountable as almost a performance athlete. The day I do your surgery, you want me at a 10, right? That has to do with nutrition and fitness and sleep and mental well-being and preparation, right? And so I've really started to become interested in that, partially like selfishly, but I talk to my patients about that all the time. And the way that translated over into our family, so I have, a 15-year-old and 11-year-old twins, and they're just like, they're incredibly like amazing, like little human beings. But my son is like just such a hard worker, and he's been given so many gifts, right? And he's trying to understand like how did you get where you are, right? And I'm talking to my wife, and we're both medical, and we're thinking, gosh, like when I was in med school, I would get up at 3:45 and I would study the lesson of the day before the lesson happened. Then I would go to med school all day. Then I would go for a run or exercise, and then I would study some more. And that work ethic, it came, right? And how do we instill that in our kids? And, my wife's family was first generation. Like they came, they worked hard. And so that's where we really came up with this. So we call it the Good Family Initiative for Vision and Excellence. So GFIVE, G5, and there's 5 of us. And so that's like how it came together. We've got a logo. And then, our goal is each of our kids has certain goals about their education, first and foremost, their health and fitness, their extracurriculars, their family. And so we each have these things. And the goal is, we're setting these, they're learning about work ethic, about working hard. It does involve getting up early in the morning and doing some exercise and journaling and meditating and stuff together, which some of us do better at other things. And I will admit my 8th grader is about to graduate, so he's definitely on break from that right now. But it's been just really amazing to spend that time together and to translate that through to, my own, fitness and happiness, but also like patience. It's a great tool to be like, hey, like we can make these set small goals every day to achieve great things over time, right? And that's what we're trying to do with the victory stories at VSI and our patients, and that's what we're trying to do in our family.
Well, it's so interesting how those two things play back and forth,
that's
right?
what I was about to say.
So when you really live out those aspects, you live them out in your family and all those things happening, but it's the same thing you're doing here, right? You're essentially turning what we've done for a long time, which is retrospective care, into prospective care, right? Like hopefully we never need the care. So what can we do to not ever need surgery? That's the hope, right? That would be a great goal for yourself, for your family, for patients that come in. So like you said, if someone comes in and you're like, I know the things that are going to contribute to a back surgery in 10 years, let's head them off now. Like that's not a conversation that you have to have, but it's a conversation that you're living out in your own life. And it's clear and very apparent here. I think it's a fascinating topic.
Well, not only that, one step further, it goes back to quality of life. And so you're doing it like in your life, and then you're doing it for your patients. It's all the way through. And I'm ready to sign up, so send it over.
Great. We meet every morning at 5 a.m.
I don't know. I'm really bad at that, but you got me motivated right now, at least for a week.
Oh, it's awesome.
Well, we appreciate every minute that you've given us. This has been incredible being able to come out here and see your practice. I want to give these last, few seconds here. Where can people find you? Talk a little bit about where people can find you and, your brand.
So VSI is spinemd.com. So we're in Reston, Virginia. So Dulles Airport, Reagan, Baltimore, and like purposefully we're located here so that we can be, you know, yes, three states right around us, but also kind of in the middle of everything. And
super easy to get to.
Absolutely. And so, you know, we love to hear from people. We love if people are like, hey, am I a candidate to come out there? And it's common for people to call and talk to someone or send in their images and be like, hey, like, based on what you see, am I a good candidate? Is it worth me coming out there? You know, and so we're really able to, you know, do all kinds of things to be able to reach out and help people. And just really thank you so much for inviting me. I think what you've done so far has actually just been amazing, and you two are awesome at this. So it's really a pleasure to be able to sit down and have such a kind of a fun conversation. And I think I hope that'll come through to the audience and the people who are listening. So appreciate it.
Well, it's only good if we've got a good guest, and you've been fantastic to sit and chat with. I don't want to leave.
Exactly right. But for people that are looking for you, like you said, Spine MD, I mean, the branding is unbelievable. You have all your providers here, all the work that you do here in Western Virginia. And then, you know, you're on podcasts, you're on the news, you're on Instagram and everything else. So people have no problem finding you. But for people that haven't, absolutely go check those things out, because this is a special place. And we, you know, just like you said, we're excited. I think we're all driving towards those same things. So it's great to see a practice that's living out a lot of those values.
Absolutely.
Awesome. Thank you.
Awesome. Thanks so much.